So this is a fascinating story. This is varicose vein during pregnancy. This lady is on her fourth pregnancy, 8 months pregnant. She comes to my office with this foot, and this is before. And here is the after picture. You can see it's just unbelievable. One can't believe it's the same patient. And now I'm going to show the back of the leg, and then this is before, and of course this is after. So significant improvement. We treated this lady. It's a combination of using a laser to close the veins and injections. This is the side of her foot. Of course, see the outside of the leg, about the midsection. You can see some varicose veins there too. And now I'm going to show the back of the foot, and you can see the varicose vein coming all the way down. And you can tell there's a massive amounts of varicose veins over her foot. She has young children. She says every time they banged into her foot, she would literally scream in pain. She has all the other symptoms and signs, which was cramps, etc., etc. But what is so unusual here is that so many of those veins are on the foot, although they actually start in the groin area and move down. Also, those veins are so large, and they're pretty much coming to the surface, and there's also a risk of course, rupturing and bleeding. The problem is, she's 8 months pregnant, and obviously that's not a good time to operate on her. I wish we had caught her a little earlier. She states that she really had it for about 5 years before I saw her, and this is after a few pregnancies, which unfortunately does make the veins worse. Now, it doesn't cause the vein problem. Vein is genetic, but every time you have pregnancy, it makes it worse. But then I saw her about almost 5 months later. Here's the video. You can see the foot is almost not recognizable. All the veins have disappeared. Very minimal pigmentation. That's from iron deposit. That's also going to disappear. You can see the ankle is no longer swollen. It's all shrunk. All the symptoms have gone away. She's amazed how much energy she has in her leg. Now she can chase her 3 or 4 and 5-year-olds all around the house and not worry about it. The ankle looks really good. There's still some veins there which are gradually disappearing, and some of them obviously would require to have some more injections. The left leg also looks very good in here. Now, one thing I haven't mentioned, once she had a baby and she was going to come back about a month or 2 months later, once the pregnancy has settled down, for us to take care of her vein. But unfortunately, she ended up getting a clot, ended up going to the emergency room. At that time, we thought, we better see her a little earlier and take care of it. So there is a risk of getting clots. Fortunately, the clot hadn't gone very deep into her system, and thank God it didn't happen during pregnancy. So these are the things. If you see any problem with your veins and you're planning to get pregnant, please go and see a vein doctor.